Most people understand what causes whiplash in humans. Research shows that auto injuries can weaken a person's neck. The bones of the neck are held together with bands of tissue called ligaments. The ligaments keep the spine stable and protect the spinal nerves. During a car crash, a person's neck is exposed to a rapid, violent motion that may strain or tear the ligaments. A 2006 Japanese study performed an anatomical study of the human neck under simulated whiplash motion. They found that the forces involved, even in a mild collision, can stretch the ligaments to a point that reduces their ability to stabilize the spine. Weakened ligaments can result in permanent disability and chronic pain as the spine can lose its stability and integrity. The biggest danger with whiplash injuries is that the symptoms can take years to develop. Too often, people don't seek treatment until more serious complications develop. For people that have been in a car crash, it is important to get treatment right away to prevent worsening conditions. A chiropractor can determine the nature of the injury and develop a treatment plan that will get you on the road to recovery. When animals jump over things, their neck experiences similar forces that humans experience in a car crash. When an animal jumps out of, off, or over things, their necks experience similar forces. As the body begins to fall, the animal is looking up at the handler, owner, or other point of interest, its neck arching backwards. Gravity accelerates the head towards the ground faster than 8 miles per hour. As the head drops below the level of the horizon, the central nervous system reacts and stimulates the muscles of the neck to constrict in an attempt to keep the eyes level with the horizon. This action may result in minor stress to the muscles and ligaments of the neck, or if the trauma is severe enough, this violent rocking of the head may result in stretching and tearing of soft tissue structures in the area. Even the small traumas are significant, as human soccer players are proof that repetitive small traumas, heading the ball, over an extended period, may have a detrimental effect on the cervical spine. In a recent study, 2 veterinarians looked for evidence of cervical acceleration, deceleration, or whiplash by determining the presence of lower cervical and upper thoracic subluxations. Of all the dogs in the study, regardless of age, breed, or athletic discipline, 63% of the dogs in this sample showed symptoms consistent with whiplash. There were no age correlations, injury predilection. Of all dogs that jumped for a living, 80% of them showed incidents of symptoms. It became apparent to the authors that jumping was the main reason for these injuries. This was further supported by the dogs that didn't jump routinely during their normal daily life, where 18% had symptoms consistent with whiplash. Some dogs will present with slight problems in gaiting, and then there will be variations of everything in between. The spinal cord is subject to injury from compression, stretch, and torque mechanisms. Its position within the spinal column gives adequate protection during normal range of motion. Damage occurs when the cord and column are subjected to severe forces. Healthy joints are able to make positive adaptations to stress. Unhealthy joints are unable to keep up with stresses. Chiropractic adjustment enhances the joint's adaptive processes. Routine chiropractic adjustments will remove the subluxation and restore motion in the affected joints. This will help return normal neurological function to the animal. This is important since accurate proprioception is important in the avoidance of sports injuries. In 1984, a study published in Spine illustrated the reasons for spinal manipulation in dogs. The researchers produced mechanical fixations in the spines of dogs and later noted changes in the margins of adjacent segments. These changes included fibrous ingrowth, vascular invasion, osteophytosis, subchondral remodeling, chondrolysis, absence of proteoglycans, fibrillated cartilage, and loss of motion. Some of the changes became irreversible after only 2 months. Whiplash is definitely a clinical symptom seen in active animal patients. When identified and treated correctly, whiplash can be managed successfully. If it is ignored and misdiagnosed, then the lesions of whiplash will become a chronic problem for these animals. Contact your AVCA certified animal chiropractor today to get your animal on the path to better spinal alignment.